issue of AIDS, and that's how I think that we've dealt with the STD issue up until this point on this particular show. And I think other than since your visit with us in 98, 99, I don't think that we've done that much with STD as such. But
well, HIV, I don't want to take anything away from the issue of HIV. It is a very important issue, one that we deal with, and it is important particularly in the African American community, because the rates have not dropped off as they have in some other populations. Women between the ages of 25 and I think 30, 34, it's the #1 cause nationally for African American women of death. It's not breast cancer. It's not some of the other ailments that you might think of, congenital heart disease or what have you. It's HIV for African American women.
In a real sense, Ms. Whitlow, that's the kind of information that we've been getting in reference to AIDS, that it is. Now, could you use what you're doing, the kind of outreach that you're having dealing with, I think because you deal with teenagers in reference to that, but do you ever, in a real sense, deal specifically with the AIDS issue, or do you just put them all together as you indicated, it is an STD? But do you sort of separate that to talk to them specifically about this disease?
When the case warrants, but we try to provide as much education about as many sexually transmitted diseases when the opportunity presents itself. So we want to talk about the whole cadre of sexually transmitted diseases, including HIV, to drive home the point of the importance of health and being sexually responsible with regard to all sexually transmitted diseases.
How has the public school system responded to this whole issue of STD, Ms. Whitlow, especially when we remember that for the most part, you know, people have difficulties dealing with sex and education and those kinds of programs in school? Well,
sexually transmitted diseases is a part of the curriculum on that, is part of the core curriculum in Metro. And so in that respect, you know, it's when we think about Tennessee, we don't sometimes think favorable on our educational system, but it is a part of the core curriculum, and those subject matters are taught. We frequently go to schools and talk about abstinence, and as well schools come to our STD-Free haunted house that occurs on Tennessee State's campus by the bus loads. So we can't say that in Nashville that we've been responsible. We probably need to increase
what you're doing.
The information that we provide to young people.
You know, over the last couple of minutes here that we have here, Ms. Whitlow, let's give you an opportunity to perhaps speak to some of those issues that you felt to be very, very significant in terms of your visit with us today that you might have had an opportunity to say anything about.
Well, I think one of the messages that I definitely would want your audience to know and be aware of is that sexually transmitted diseases, all of them are preventable. All sexually transmitted diseases, even HIV, are treatable. So I guess when an individual, perhaps if they have, you know, we ask all the time, well, why, you know, is there this issue of STDs when we know how to prevent STDs? But if, you know, if you've got 15 problems, certainly, if you suspect that you have a STD, you don't want a 16th one, so people just prefer sometimes not to know. But what we want people to know is that treatment is simple as going to the Metro Health Department. Testing now is easy as taking for HIV as easy as taking an OraSure test, and it's quick, and many times it's free. So we want people to make the services at the Metro Health Department available, avail themselves of it, and as well seek out testing in these community type of situations where there's entertainment. The STD-Free model is entertainment in the park, and food, free food, music more, and then we also do some things around providing some incentives and T-shirts and that sort of thing for individuals. So that's our model, and we think we've been very successful with it.
And so you think you're doing a very, very good job in doing what you're doing?
I think our referrals and calls suggest that. People reach us by calling 297-0STD. And that's very easy to remember, or 297-0783.
Very good. And of course, Ms. Whitlow, let me thank you for bringing that excellent information live with us today. And let me encourage our audience to tune in again next week to another informative edition of Comments. Thank you, and